culturally competent nursing care for African Americans. African Americans, also referred to as Afro-Americans and Blacks, are people of sub-Saharan African ancestry. Most African Americans are descendants of slaves that came to the Americas from Western or Central Africa via the transatlantic slave trade. African Americans include a wide variety of ethnicities and nationalities, such as Nigerian, Congolese, Kenyan, Ethiopian, Yoruba, Zulu, and more. The primary language of most African Americans is English. Many African Americans speak regional dialects based on where they are in the United States, or Ebonics, an English dialect that is spoken by people of African descent in North America, the Caribbean, and West Africa. African immigrants may not speak English fluently or know English. African languages include Swahili, Zulu, and Yoruba. Other languages commonly spoken throughout Africa are French and Arabic. Use a certified translator to communicate with patients who do not know English or if English is not their primary language. The predominant religion in the African American community is Christianity, specifically Protestant denominations. However, African Americans also make up a significant number of America's Muslim population. Some African Americans may follow religions or spiritual traditions that are rooted in traditional African religions, such as Vodun, also known as Voodoo. Most African Americans follow the biomedical health model of understanding health and illness. According to the biomedical health model, life is controlled by physical and biochemical processes that can be manipulated by humans. However, there may be some African American patients that follow the magico-religious health model, which claims that health and illness are controlled by supernatural forces, such as the will of God or magic. Some African Americans may practice folk medicine that has roots in traditional African practices. Examples of folk medicine practiced by some African Americans include using Spanish moss that is brewed into a tea to help make childbirth easier, and burning buzzard feathers and inhaling the smoke to treat rheumatism, arthritis, and epilepsy. Ask the patient if he or she uses herbal remedies or traditional healing methods to determine possible drug contraindications. Key elements of African American culture include strong kinship bonds, strong religious/spiritual orientation, multi-generational households, and child care being done by all family members. In many African American families, the oldest female family member is the head of the family, and mothers play a major role in African American families. Music, dance, and physical activities are also common sociocultural practices. ACE inhibitors, a class of antihypertensive medications that include medications such as lisinopril, are less effective in treating hypertension in African Americans, possibly due to low pre-existing activity in the renal angiotensin system. Bidil is an antihypertensive medication that has been proven effective in African Americans. Loop diuretics are also commonly prescribed to African Americans with hypertension. African Americans are at high risk for developing hypertension, acute myocardial infarction, and other cardiovascular disorders. Cases have been shown that hypertension in African Americans develops earlier in life and is more severe than in other racial groups. Furthermore, cardiovascular disease is the number one cause of death of African Americans. Sickle cell anemia is a genetic disorder that changes the shape of red blood cells and occurs in 1 out of 500 African Americans. Another genetic disorder African Americans are at risk for developing is glucose 5-phosphate dehydrogenase deficiency, which interferes with glucose metabolism. Other disorders common among African Americans are diabetes mellitus, glaucoma, H. pylori gastritis, and chronic kidney disease. African Americans are also at higher risk for overall cancer incidence and mortality rates when compared to other racial groups. Institutional racism has unfortunately crept into medical practices and has caused African Americans to face healthcare disparities. Examples of healthcare disparities among African Americans include African Americans not being adequately treated for pain, being misdiagnosed for schizophrenia when they have depression, and having a higher infant mortality rate compared to whites. Avoid using African American stereotypes such as all African Americans have a criminal background or are good at playing sports.